Okay, my name is Lindsay. I'm a BSN student at McKendree University, and I have to take a class over nursing management and leadership. And this is my presentation over communication. So what I'm going to talk to you about today is what communication is, what the little bit of aspects are, like informal versus formal, what is intrapersonal versus interpersonal, and how we use it in daily life. So, let's start. All right. So we're going to kind of make this presentation kind of an open forum. So we're going to kind of have a conversation, okay? So the design of this project is to further our ability to communicate. So how do we communicate with each other, okay? What's our goal? Our goal for the discussion, or for this presentation, is going to be increasing the ability of management and of staff members to communicate with each other, and of staff members' ability to communicate with patients. And then I'm going to facilitate a couple of tools on how to do that. Okay? So right here, these are our 3 objectives. I'll let you read that over if one of you would like to volunteer to read them. Who would like to?
She's closest.
Okay.
The nurse will be able to teach back 3 basic qualities of a communication to other staff members. The nurse will be able to demonstrate a communication technique to the presenter that deals with a difficult behavior seen in the unit. And the nurse will be able to explain the active listening communication technique to the manager using an example of a difficult patient behavior seen in the unit.
So we know that the patients that we've been seeing here are widely just dementia patients, and that oftentimes we're getting more and more differently behaviored patients, correct? So this is going to kind of try to help us navigate those differently behaviored patients and how to communicate. Okay? So let's talk about what is communication. We're going to talk about formal versus informal. So you do this without even knowing that you do it. You do formal communication with your management. How do you do that? You do that with writing, with emails, with meetings, with speaking engagements, like when they hold formal meetings like the fall meeting, or like the monthly meeting that we had a couple of weeks ago where all the directors came. So those are your formal communications. Your informal communications are going to be like the pop-ins that you pop into Wendy's office. Those are informal. The 5 in 5, that's an informal communication. It's just her thoughts to you informally. Okay? Then you have 2 things, interpersonal and interpersonal. Most of the time people think that this is just a form of communication between 2 people or a group of people. Most of the time people get this confused with intrapersonal conflict and interpersonal conflict. The difference is intrapersonal is our thoughts, feelings, and ideas over a situation. Interpersonal is how a group of people think, feel alike over a given situation. And how that's different is you may have thoughts and feelings that conflict with the group, and how do you navigate that? Okay? So having a solidified thought and feeling, and then how does that play out in the group? Okay? Can anybody give me an example of maybe an intrapersonal conflict that they've had recently? No? How about an interpersonal conflict? Where maybe the thought of the group conflicted with a patient behavior, or a treatment of a behavioral patient.
Okay, well that would happen where nurses to doctor then.
Okay.
Where the nurses feel that a certain patient should be maybe treated or a treatment looked at in a certain way, and the doctors may for whatever reason, feel that they have a different solution.
Perfect.
So.
That's
AKA a fentanyl patch.
Yeah, there you go, there you go. So this next slide, I kind of have to go a little piece by piece. I apologize that it's a little small. But it's kind of the whole communication process in a small loop. You have the sender. The sender is the first person. And what they're going to do is they're going to encode a message. They're thinking about what they want to say and how they want to say it. So that's not even necessarily with words. It could be a writing medium. It could be nonverbal language, a thought and feeling that they need to express, but maybe they can't express given the certain circumstance. So they're going to think about that. That's encoding. Then they're going to develop that message and send it via the channel or the medium that they desire to send it. Then the person receiving the message, that's obviously person number 2, they're decoding the message. What is this person actually saying to me? What's the message they're sending me? How am I receiving it? Now the fun part is all the ambient stuff around you. That's the environmental chaos. That's all of this down here, all the noise. That can affect your communication, given that be a yelling patient, a combative patient, a doctor yelling orders at you, another nurse needing help. All of that's going to disrupt that line of communication. But the whole point of communication is not just a one-way street. It has to loop back around to the first person. The receiver has to then send a message back to the first person sending the message, okay, or person A. So this person has to then encode a message and send it back through the same channel that they select to person A, who then decodes and receives the message. So you can see how there could be a lot of difficult ways or difficult things to overcome to then receive or send a message, right? There's a lot of environmental issues that we have to get over to then receive and send messages appropriately, right? So again, it's short and complex, but in the gist, that's the basics. All right. So, what are some things that can inhibit communication here in the unit? I've listed those kind of, sort of. Some yelling patients, different behaviors, like one we have who's repeating all the time. You're trying to communicate a message, but she's just repeating. That's a problem. You're sending the message, but she's not necessarily receiving the message. And when she does receive the message, what is she sending back? Is she sending back viable feedback? That could be an issue. What ways can we make sure that communication is clear and concise? Are you sending a very clear message? And that cannot be just with staff. That can be with management. Is management sending a clear and concise message to you as staff members on policy, on procedure, on what they expect from you each day? How can they make it better? Okay? So all of these areas, it starts at the top and it works its way down to the bottom. Everybody has to make sure that they know how they're communicating, and they have to know how the receiver is receiving the message so that they can send it appropriately. Right? Okay. All right, so now the tricky and fun part. So management, how do they communicate with you? They communicate with you in the way of formal and informal communication. Like we said, Wendy sends out the 5 and 5. She gives you little pop-bys in her office, but she also holds formal meetings, right? And you do the same with her. But are there things that she could be doing better? Do you communicate that to her? Do you feel comfortable communicating that to her? Things that are important. And then staff. Oh, it's always so fun to communicate with staff. These are our friends, our buddies. These are our pals, right? So we try really hard to communicate a message, but what if you're in the thick of things and you need to send a message quick? How are you sending that message? Is it getting across to the other person concisely, but in a way that they can receive it well? Do you ruffle feathers when you send a message? Could you be sending the message better? In this way, I think that there's a couple of tools that we have here that could really help us to send a better message, whether it be to management, or to other staff, or to patients. So I'm going to hand you these tools here. You have yours here. This one's for you. Let me grab mine really fast. So this first one we're going to look at is SBAR. Now that's a common thing that we know, right? Nursing staff, we know we use SBAR to send a report to each other back and forth, right? Situation, background, assessment, recommendation. Now it's listed there for you. I shouldn't have to go over it. This should be kind of something you do every day, right? Is that something you do every day? Kind of, sort of.
We do an app, so.
In some format, right? Mm-hmm. Okay. But just being able to give a generalized situation, a generalized background of what's going on, a generalized assessment of what you see, what you've experienced on your shift, and kind of the recommendation moving forward from this shift to the next shift for that new nurse. It kind of helps keep the continuity of care going along, right? The next one is probably the most important for me, for staff to patients. This is going to be probably new to some of you. It's called the GRR. It is greeting, respectful listening, review, recommend, request more information, and reward. Greeting is greet and provide an open environment. So you're greeting your patient and providing an open environment for them to discuss anything. Respectful listening, that's active listening. Do not interrupt. Give pause to allow the other person to process. So if they're giving you the message, are you taking enough time to listen, hear what they've said, take a pause to process, think about what they've said, and then give your message? Or do you have an automatic answer? Are you pre-programmed to have an automatic answer? That's not active listening. Review. So restate the message. Ensure that the message was received. Am I hearing you correctly when you state blank? Did I hear you when you said this? Correct me if I'm wrong when I heard you say blank. It reassures them that you're trying to be as clear as possible, that you heard the message that they sent. It really gives them a caring environment to be more communicative. And then recommend or request information. Invite more information when it's warranted. Sometimes you don't have time to sit and have a full conversation, but when they're ready to be open, be willing to listen. And then reward. Be kind and courteous, thank others for sharing, and leave them with the opportunity to further share. Reward them for opening up. Invite more conversation. Even if it makes you late, even if you don't get that 5-minute break, it really makes a difference. When they feel like they can open up to you, you will get more from them. Big, big tool. All right, so I'm going to skip a couple of these. So in my conclusion, my hope for you is that we grow. We grow as a unit. We make strides to be better communicators with staff, with patients, with management, the whole way, up, down, sideways. If we're not communicating, we're failing as a unit. So it's my hope for you. And I hope that you do this by, again, restating those 3 main objectives, is that you can utilize these tools to kind of help reteach yourself how to communicate. Questions or concerns, comments, thoughts? Did you like the tool? Could you use it?
Very useful.
Good, good. All right, so now we're going to do an active listening discussion. I'm going to read something extremely fast, and you're going to see if you can tell me what you heard. Okay? All right. So Betty, or B, is a 45-year-old patient who is here because of suicidal ideation. She's in a room 287 and has a full code status and not a fall risk. She was admitted after presenting to the ER via EMS, was found in her bathroom with 2 large lacerations to her forearms. She has been diagnosed with depression and anxiety and insomnia. She has no known allergies, she's independent, and her last BM is unknown. She is not on a restricted diet. Her vital signs were 150/86, pulse rate of 72, respirations 18, O2 saturation of 97% on room air. At this time, there are no labs have been ordered and no future orders are at this time. Patient is non-compliant with medications. There are no legal orders on file. She is not contracted for safety at this time, and at this time she has been stitched and bandages have been placed. Patient spoke with the intake coordinator and is evaluated for placement. She arrived at the unit 10 days ago and is taking Ativan 0.5 milligrams PO PRN for anxiety, Trazodone 50 milligrams PO at QHS for sleep, Klonopin 0.5 PRN BID for anxiety, Zoloft 50 milligrams PO QD AM for depression. Now, while giving this report, B comes running down the hallway screaming obscenities, pushing down a patient, using her walker to throw at some staff members. She's exclaiming, "I'm going to kill you!" The nurses jump out of the way of the walker and get away from B and into the nurses' station to call for help. Once the police arrive, B is secured in the isolation room, and the nurses overheard hearing her say, "I hate it here. I hate those nurses. They're trying to kill me with these medications." Now, once report is finished up, it is the night staff's issue to take care of the patient. Now, how many of these questions can you answer? What's the patient's name?
B.
She likes to be called B. What's her first name?
Betty.
Betty. What is the nickname she prefers?
B.
There you go. What is the night shift nurse's name? I didn't list it. My apologies. I put it in and then I took it out. What's her code status?
Full.
Is the patient med compliant?
No.
What's her diagnosis?
Suicidal ideation.
Anxiety.
Depression.
What brought her to the ER?
Lacerations.
How much Ativan is the patient getting?
5.
You are correct, ma'am.
PRN.
What other medications is she on? Try listing just one.
Clonazepam.
Trazodone.
Zoloft.
Yeah, good job. What is her expected discharge date?
None mentioned.
None mentioned. Good job, that was a trick one. Where was the patient found?
In the bathroom.
In her bathroom. Who found the patient?
EMTs.
EMTs. So, what are some active listening phrases you could use to help build rapport with B now that you're the night shift? Using this GUR method, what could you do?
Greet her.
How would you do that?
Hello.
Pretend I'm B.
Hello, B. It's nice to meet you.
Nice to meet you.
I'm Kathleen. I'm the night nurse tonight, and we'll be providing a room for you to stay in and some toiletries, and we will check in the clothing that you brought, if you brought anything with you. If not, we'll provide you with clothing for tonight till you can